Welcome, everyone. I am very happy you guys are here today. Thank you for joining us on what is a hybrid model in participant direction.
Ready, good to go?
Good to go.
All right.
So, who is the PA Family Network? Let me tell you. Happy to tell you. The PA Family Network is a program of Visions for Equality. Visions was started 27 years ago by two mothers of women with disabilities who wanted to see change in the system. The PA Family Network is funded by the Office of Developmental Program through Visions for Equality. All of our work is vetted by ODP. Advisors with PA Family Network are all family members of individuals with intellectual and developmental disabilities or individuals themselves. All of our advisors are life course ambassadors or in process of becoming one someday. And not only our advisors spread across the Commonwealth, they have diverse life experience. Some have medical experience, behavioral backgrounds, or an understanding of other programs. We have siblings and grandparents bilingual, family and self-advocate advisors for Spanish, and a bilingual tag-along self-advocate advisor. Next.
Okay. Now, what we are doing, most of the, everybody knows we are doing different workshops to trying to educate the families to see how they can work to trying to be better advocate for their loved ones. We, as Ernie mentioned, we are funded by the ODP department. I'm sorry, I need to apologize if we use acronyms. That is all the time we do that, but we're trying to avoid to do that. The Office of Development Programs is the one who are helping us to get all this information, give us all the technical assistance that we need, trying to provide that for you. And also we have different mentorings that will be for family, that will be for groups, or there will be some individual mentorings that you are able to share some experiences with us to try to help you how you need to create a better vision and create better support and services that will be able to helping you, your loved one. About mentoring, like I said, we can work one by one if that's you wish, or we can work with a team. Doesn't matter what kind of the person you have in your list working with your loved one. We can have financial mentoring. We can have medical because, you know, our kids are different diagnoses and we need to accomplish every single one. And we need to work together to try to get the brainstorm helping your loved one. That's what we are doing with mentoring. Give it the brainstorm that we needed to try to get the better support and better services for your loved one. And also, you remember our characteristic 3 buckets. They are the ones we want to help you, especially because we want to helping you to work with the system navigation, how you need to work with different support, how you need to get all the information that you need to have all the requirements that you need for your loved one. Develop all that website, get all social media, trying to interact each and another, family to family, family with supports. Identify what kind we can do for you and how we can find all the services and supports that your loved one is needed. Well, why we are doing this? I need to read this because I don't want any phrase will be misunderstood. For individuals with intellectual and developmental disability, the role of the family is unique and often central in the support and care provided across the lifespan. Family members play key roles in identifying and security opportunities for the family members to participate in a meaningful way with their community and ensuring access to the self-determined lives. All this information that was in March the 2006, there was for the conference with the Western. We get all together family to try to see how they can find better support for the loved one. And that's when they create this, they call community practice. That's when we start to get all these different community practice around the state. Pennsylvania was part of this community practice in 2016.
Let's talk about an everyday life. How does a person truly live a determined life with activities they enjoy while staying safe and healthy? Participant direction is one of the best ways to make that happen. That is why most people choose self-direction. So what is a participant direction? And why do individuals and families choose this form of directing services? This information is directly from the Department of Human Service web page and Intellectual Disability Service participant self-direction if an option of service delivery. And participant direction service is in accordance with the principle of self-determination, choice, and control. The Office of Developmental Programs has made participant directions available. Participant directions, also referred to self-direction, allows individuals to have more control over where, when, and how some of their service and supports are delivered.
Okay, while we are doing this, everyone need to have the opportunity to participate in things that he like it or they passionate about it. Probably sometimes they will be a little different. It's according to necessities of each individual. That make us to think a little different about the opportunities and services, and of course, the different opportunities that we are able to provide to the loved ones. This is about why participant direction is the best way to make everyday life happen. Like I mentioned before, that will be sometimes not the best choices for everyone, but there will be have some programs on different opportunities that, like Ernie, who's a self-advocate, will be able to take part on it. That means something that he likes it, something that he's passionate about it, and of course, it's something that he can live everyday life. That is our point here. Okay, what we want to talk about that? Well, we are discussing different ways, many different ideas about how we want to work with this. I know sometimes it's a little confusing and maybe it's unclear what exactly we want to do. You hear about the waivers. I hope so you are familiar with all the waivers and all the different services who are provided by the waivers. The Pennsylvania Family Network is available to answer all that questions. If you have one, you can reach out to us, or if you prefer, you can sign in the different workshops that we have about waiving the waivers, and we can give all the opportunity that you can learn more about that, and if you have more questions, you can ask for that. But at this moment, we don't want to work anything about waivers. We want to focus about the different things that we can able to provide with the self-direct information. That one is one of the services that you can find if you have the waivers. You can have services that can be self-directed, the difference between traditional models and self-directions, and how these hybrid models service to delivery for make all this happen. I need to move this here because it's, let me here. Okay. Oh, what's happened? Don't let me go through. Okay, now. Ernie? Now we want to start to have all the basics. Well, first of all, we want to start to mention to you different acronyms. I hope everybody is here about this. Like I mentioned before, we apologize if we use acronyms, but that is all the time we are doing that. We're trying to use all the full name. That does mean everybody will be familiar with the terminology that we want to use. If you are able to, I hope so for this morning also. This morning, you must to receive an email with the PDF about the presentation. And if you have any more questions, you can have all the information for Pennsylvania Family Network at the end of the presentation. This is something that we want to work. What is the mean surrogate? What's the mean Office of Development Programs? Agency with choice, vendor fiscal, employer agent or one statement. That is different acronyms that we usually use when we are working with self-direct services. This is more of that. I want to give a couple minutes that you can read it. Okay, now we want to start. I mentioned before about waivers. You know, we had different waivers, but we want to focus more on the ODP department, Office of Development Programs waivers. We don't want to talk about any other waivers about community health choices and also autism, because that is different kind of waivers. We want to focus only in these ones. We know that we have 3 different waivers for the Office of Development Programs, with the Person Family Direct Support waivers, who has a cap of $45,000. And of course, he has $15,000 extra if you want to look for employment, advanced unemployment. We have Community Living waiver, who has the cap of $85,000. And also we have the community, the consolidated waivers, who has no cap, but isn't based on the needs for the low one that you have. I mentioned this because if you have any of these waivers, you will be able to have the services that we will be talking about. Quiz about the, I'm sorry, about the traditional participant direction models. Okay. Everybody has a model to work with when you have participant direct services. We hear about that we have 2 different ways to have all the services delivering to you. We have the traditional model, who is when I think most of the family has that one, as when you have the person who is looking for a quality provider in the area who provides services. They send the different way staff with different activities, depending on the schedule that you have already for your loved one. That means the decision that you do in the traditional model is you are the one who are the decision with the family, with the surrogate. They make decisions, and that's what they are doing, the different activities. Meanwhile, when we have participant direct services, for example, is when you have a family member who are in charge to get a schedule, make phone calls, make an appointment, and create different activities for your loved one. Okay, he's planning all that schedule. He's the one who takes all the decisions, and the person direct manager schedules and they call surrogate, and they have all the services delivered to them. And they usually, all these services, they must to be listed when we call the individual support planning, the ISP. It's a little complicated, but it's not so bad. That means when you start working with more of that, you will be more familiar and that will be easier. Okay, here. Now, when you are working with direct participant services, you have 2 different choices. You have the opportunity to work with agency with choice, who is the one who the person or the surrogate or the agency who's working with give services and support to your loved one, they are looking as an employer. Yeah. And they are the one who take the decisions and take all the information and get all the timesheet, get everything ready for them. That is what they call with agency with choice. When you are working with vendor fiscal employer agency, most of everybody knows as a PALCO right now, is when the participants and the surrogate come to be the common law employer. That means he will be doing everything, get timesheet, get everything, and they will send them to PALCO, and PALCO is the one who will be send all the budget out or the money out. Now, when you have the waiver and you want to have direct services, support services, like I mentioned before, everything must to be listed in your individual support plan. And they will be provide all the subjects and all the limits for you want for the services to be part of. When all these services, they will be changing accordingly the waivers. If you change waivers, there will be some changes in the support or services that you will receive. That's why it's so important that everybody, the participant, the surrogates, they must to be stay on time with all the different changes, all different notes, and all different information that they will be provided in the different bulletins or notices they are given to us. This is some of the services: income and community services, support employment, participate direct goods and services, assistant technology, support broker, home care chores, and unlicensed respect. We can give a little example here to be a little more easy for you to get. Is, for example, if we have income and community support, is when is the staff person receive the services, could be one-on-one, or we don't know the services that you have. Is listed in your person who is the staff is known as a support services professional. And this is the one who will create different activities, create a schedule that you can enjoy your everyday life for the loved one that you have. This support services professional, they create, like I mentioned, for example, working with the individual for helping him to hygiene in the morning, work with any kind of hygiene, work with any kind of life skills, helping him to be a volunteer outside, maybe learn to use the microwave in the house. Is part, all these services that they support professional, the service support professional is helping you, they must to be listed in your ISP, because it's something that will be better for the individual's outcomes. That means something for the individuals to be part of the everyday lives. Okay, this is more services that we are able to find if you want to sell direct services. And you can see many of the services could be outside. For example, we want to talk for transportation. Transportation maybe will be reimbursed with the support services professional, because remember, when you have community outside, you need to travel it, and that must to be reimbursed if that is part of the ISP you have listed. I'm sorry, individual support planning. And of course, that will be help for somebody to go, for example, go to the college, take classes then, trying to get a job. If the person decides to choose to get self-direct services, that depends in what is the interesting that he's doing and what is the needs the individual has. This is another one that we mentioned that we can have for the sell direct services, companion, transportation, specialized supplies, home accessibility, education support, family care, caregiver training and support, and vehicle accessibility adaptations.
Everyone is different. In fact, some people find that they have needs that aren't being met and are not being met the way they want it to be. Through participant direction in one area or another, they might have great success overall with the PDS, but maybe they have an open hole in their schedule, or they want to look at something new and different. What are the options? Maybe they need to look at a hybrid model. So what is a hybrid model? A hybrid model of service is when an individual chooses to self-direct some services and use traditional agencies service for others. This requires thought, scheduling, and careful conversations with everyone involved, but can be successful. Planning is the key. Let's look at the scenarios. So we look at two very simple scenarios. Everyone is different and has different needs. For the purpose of this workshop, we need to keep the information straightforward and easy to follow. So using the hybrid or blended model of service delivery. Next. So here's the first. So here's the first scenario. Samantha is 22. Her mom passed away a long time ago. She lives with her dad and sister. Samantha has a waiver. Her dad is surrogate and they use participant direction. She has 2 part-time SSPs, but needs more activities, more support, and wants to meet more people. How can she do all those things and stay busy always? How can she stay safe?
Okay, if we notice here, Samantha is 22 years old. He really like to be active, and he only has 2 support service professionals helping her. Her dad is the person who take decision, who has all the schedule. He's the surrogate, but he's a widow. That means he has practically busy all the time, and he want to keep Samantha busy, and he need help. Her sister apparently is able to help, but not all the time. That means he need to create different activities or different choices to try to keep Samantha safe, but also at the same time keep her busy. She cannot be alone for her security. That is something her dad is looking to trying to keep the schedule for her all the time busy. Well,
the answer of that scenario, she chose the integrated star, support star. One of the things that she has support is from her dad and her sister. Whenever she's in trouble or needs help, her next door neighbor will jump in and help. And things that she needs is more active. She wants more activity.
Okay. We want to use this tool to try to see how all the different aspects come together to try to help and fill all the busy schedule for Samantha. We have the star, we have the personal trait and assets. What is the personality that Samantha has that will be able to helping us to get what services will be helping and how we can feel that. We know that she's outgoing, she's friendly, she has a great smile, she likes to explore new places, she's interested to learn new things, and she can adopt change with support and plans in different places. That is something that we need to keep in place to try to find what another activity that will be able to do and she will be enjoy it. We have who persons are around her, who can trust to be with her, to keep her safe. We have her mom is deceased and now is only her dad. We have her sister that sometimes she is able to help, but not all the time. We have Jane, we have Aline, who's the support service professionals helping her in the part-time. And we have some extended family. We have maybe the next door, we have the daddy's best friend, and other people who are able to jump in if in case it's necessary. What technology will be able to use? Well, she loves music. She must have a CD player. She needs to have a cell phone for any kind of emergencies. She uses Alexa. She has the iPad with puzzles, and also she can see the TV. We can see all the different technology we are able to apply to helping her to fill all the spots. We have also the community. What the community is able to helping us to fill the schedule for Samantha. Well, we have different, the libraries. We know the libraries has different activities that they will be able maybe to help Samantha to fill some of the spots for the schedule that she wants to. We have yoga in the park, yoga classes. We had the YMCA. We had the, maybe she want to love volunteering the third, their store. Sometimes maybe she's talking with people in the, when she's helping in the volunteer in this store. We have different arts and crafts who are able to give you in the senior centers, or maybe we know what community is able to help, the firehouse, maybe the store at the corner. We don't know, but that's what we need to look and reach out in the community to see when Samantha can go and how he can be in the community to be safe. But also we have the eligibility services. Remember, everything must to be in your ISP. We need to have the waiver, and the waiver we have the different support activities they must to have. You know, the waivers, we mentioned before, we have a budget. We need to know if with all the different activities that Samantha has, they still have some budget to accomplish all the rest of the different activities that she wants to do. We have, in this moment, we have 2 different support staff who are working and he's being paid for the waivers. That means, and also she's working part-time. Most of the time it's like a 20 hours each day. And they say the looks is flexible hours. That means that is a pro, really good for us because we can manage it and we can change times and be more accessible for different activities for Samantha. We have that she has Social Security. He is covered, for example, rent or another fees or another activity that she wants to do. And we have different options. How about community participation support? What is this opportunities is able to have, what she can do? And to try to give more ideas, we can start to get more emphasis on exactly what we want to do to fill all the different spots and get the schedule ready for Samantha. Well, we mentioned that Samantha has, that is the one who is the surrogate and who has all the information and schedule. But also we need to be sure that everything that we want to do is being in contact with your support coordinator. We need to have a really close relationship with them because it's important to have the support coordinator, let her know what is your needs, what is the individual's need, especially and how the family is part of that. And we need to be aware of all the different resources that is available for Samantha. I know sometimes the responsibilities of the family is to be sharing with the support coordinator. And we need to have a really trust relationship with them. Remember, we need to have the bridge. We need to have a really good conversation because we need to work together with the support coordinator to try to get different services and support available for the loved one. We have, for example, daddy side, deeping more in conversation with the scenario that we have. The daddy side community participation support, the one that he used, can be used for the day program. That is a good thing because the day program, they have different times, they have different activities in it, and they can go in the community participation, and they can keep care busy a little bit for a couple hours. They decide to talk to the support coordinator, and she includes Samantha in the ISP and made the connection with the agency that runs that program. Okay, let me see here. Okay, this is
the schedule. This is the schedule of different things that Samantha would do for her everyday life. The one that the green is her dad's best friend that she's with, and how many hours they spend together. The dark blue is the CPS that she's out with, and the yellow is what she spends time with her sister and what they do outside. And then after that, the white is when she is with her dad and what activities they do together.
okay. But I'm trying to say, this is so far the schedule that we provide for her. All the white spot is daddy. That means the majority of the time, daddy is taking care of Samantha. Samantha has the two part-time support services professionals who are listed in dark blue, who is Monday, Wednesday, and Friday. But also we have the PDS, okay? There's some black and white, blue, light blue. That is most of the time when we have all these services. Her sister is able to help in Monday and Wednesday, but she needs to have help on Wednesday. That's what sometimes we asking for neighbors or people in the relationship you mentioned. We mentioned the best friend for that, the so neighbor getting there. That means the slot that is here in green, that's when we have people helping us to complete the schedule for Samantha. This is, like I say, the schedule for the support services, they are flexible. That means maybe one day when daddy is busy and they are not able, maybe they can switch the time and get that in place. That means we need to work together to try to get the schedule for Samantha be more accessible and accomplish for her, trying to keep her busy, and especially most of the time is to keeping her safe. That is the priority of the dad at this moment. Okay, if I didn't go through. Okay. Now, Samantha, when we do the STAR, we identify different activities that she will be able to participate with the support services professionals. As GET, and also we identified that she can have some community participation services or CPS with different activities in the community or the different activities provided by the agency. We can have the brainstorm together and we can create more opportunities for Samantha in too many areas. We want to create and help her, in this case, Samantha, to have the choice and control that he want to. He want what activity she want to do, and especially something that she really passionate in her, and make her the outcome that we want for the everyday life for the our loved ones. Well, what we can resume to have a resume here is Samantha and her dad determined that she had need to be being met through the self-direct services. They explored the opportunity for Samantha to participate with community participation services support and found that it was a good way to meet her needs. We're using the friends on different activities that we are able to provide for the days that she don't have any staff. And the schedule is working and it's a benefit for Samantha and especially for everyone because everybody is pitching in and helping Samantha to create an everyday life for her.
Okay, let's talk about Scott. Scott is 35 years old and used to work. COVID came and he lost his job. Now he thinks he is ready to start thinking about going back to work. Scott directs his own service. His mom helps him makes decisions about what to hire and fire. He uses in a home community supports and transportation. Scott thinks he will need a job coaching agency again, like he used to have. How can he do that?
Okay. Well, here what we can start to do is we want to have this trajectory to start to see how we can help Scott. We know that Scott and his mom choose this trajectory form or the tool to try to see how Scott can create a good vision for him, something that he likes to have a good life. I need to remind you that everything that we had, remember we had the two squares. The lower one is something that we don't want for our life. And the top one is what we want for our life, what we are looking to have an everyday life. We have at the left of the picture, we have the little arrow who go up. That means everything is what we are looking to trying to get the good things for our loved one. That's the vision that we want to create. Everything above the arrow is something for the experiences that we have, is getting to have or accomplish the good thing that we have for our lives. For example, in Scott, we have that he has a support services professional. He loves to hang out with the friends. He wants to continue working. He's checking, cooking and cleaning the house. And mom, I'm sorry, mom is the one who's getting all the system for job coaches to help with different skills that he needed. That means it's something that we are looking for to trying to get the good life that we needed. Meanwhile, everything that we have below the arrow is something that we are doing wrong to trying to go the things that we don't want to. For example, if he don't want to listen to his mom, probably he will be lonely or he will be not able to accomplish the things that he need to accomplish. Maybe if he want to go to work, but he don't have a job coach to helping him with any difficulties or any problem that he has a job, maybe he will lose the job. Maybe he don't find a job that he will be happy. That means all these different activities that will be get us to the things that we don't want for our loved one. To be lonely, to don't have choices, to be alone, to argue, to have people quitting with us. That is something that we don't want for our loved ones. That's why we need to look for good things. And I need to say this, sometimes we have bad experiences, we have bad things that make us fail, but not because you failed one time, that defines the person that you are. You can stand up and with the support and services, you will be able to have that bad experience and getting a good experience to trying to accomplish something good that you want for your loved one. This is something that we need to look and we need to work with the kids, trying to find exactly what is the vision that they want in the trajectory for what they want in the good life. We see some ideas they are working for Scott is helping him. And he has directed his life to have a good life for everyday life. We have that he has friends, he belongs to a club, he has money, he get a job, he can go to the movies. Excuse me. That means it's something that he likes, something with some activities that he can enjoy. But most important, most interesting is there are things that are important for him. Well, that's something that we get with the profile page, with the trajectory. I'm sorry, with the trajectory page. Now we can see what we can do about with the Scott. Well, we had the Scott called his support coordinator. The support coordinator met with the Scott and his mom, and they choose a job coaching agency that had all the things that Scott felt he needed and had openings. Scott has disappointed that the agency he used before he went with self-direction during COVID was no longer accepting new people, but he liked what he heard about the new one. That means something, remember COVID is coming and he put everything upside down and make everything a little out of control. But we need to come back again and we need to find all these different agencies to work with the low one, especially you want to have a self-direct services. When they are looking for this one, we know that Scott and his mom were, they don't want to go through OBR for that time. And they were able to share all this trajectory that we have with him, with the support coordinator. And that's why they are able to discuss the needs for to have care, to have Scott with a new job coach. That means support coordinator is important and we need to have a friendly and trust relationship with him or with the support coordinator, I would say. Well, this is another part of what is the conclusion that we have with Scott. Scott with the support coordinator adding different outcomes who are listed in the individual support planning. And of course, he was ready to go back to work, but he felt that he would need a lot of support to start all over again. The support coordinator added that Scott chose to go with the traditional agency model for this part of his waiver services. Remember, everything is based on the waivers with the direct support, direct supporting. The support coordinator notified the job coaching agency, the new agency, that Scott wants to start and they need to take the intake. I know sometimes the intake time they could be differently. Sometimes the agency can have people or staffing right away that they can start the services right away. But sometimes we know they takes a little while, and sometimes after we have the intake, we don't have people assigned to our cases, so they are not clearing a schedule. And of course, we need to wait a little bit. But remember, once you had the paperwork done, they were able to create a schedule to use with the services to the best advantage for the support, for support the individual. That means sometimes it's easy, but sometimes it takes us a little while to have all the intake in place.
All right, because Scott has a lot of free time and can get himself already pretty independently, his schedule is pretty open with the white space. The orange is his job coach, which they do Monday, Wednesday, and Friday. They meet early on Monday for a company meeting and then to review his work assignment. He works Monday and Wednesday and Friday. His SSP goes with him to social events on Wednesdays and Friday evenings. and other ones covers his day events on Tuesdays and Thursdays and early Saturdays. Scott mom fills in other times because he doesn't like to be alone too much. Yet he needs help with his activities of daily living.
Okay. You notice the different activities. This is a completely different schedule that we have with Samantha. That means a schedule will be filled according to the needs and the passion for different activities for the loved ones. And you see, he has a plenty schedule, fill it up. And that's when we need to start working with our loved ones if we want to have a self-direct services for them. I know sometimes take a little while to understand all this, but after you get it, it's really easy. It's accomplished because you can see the big smile on the faces of the individuals who receive all the services and support, especially because they feel they are part of the community that we want to them to be part. Okay. Now, this is something important that we need to know. We know we have different simple models that we created here, different scenarios, but it's obvious that the two types of services delivery can be blended and used together with have good planning and good scheduling for activities and services for your loved one. It's often the best way to meet with somebody's needed or just get a preference for them. You know, is trying to see what we can do. And we can practically say that in both of these scenarios, Scott and Samantha have the choice and control of what they want to do, what activities they enjoy. They are able to have participant direct services and the traditional agency services who are able to be blended. That means we can work with both models at the same time. Or we have options when we are considered through the use of the life course tools. And the most important thing is where we need to meet all the necessities, okay? We need to get, that's why PA Family Network is working to trying to create with the life course, to trying to find what is the best support services for you using the different tools that we have in the life course frame tools, okay? That means it's important that we created the self-direct services to helping them to have the choice and control that they want to accomplish the goals, to accomplish what they want to do, to have different activities that they really enjoy it, and they passionate about it. And like Ernie said at the beginning of the presentation, is to have the everyday life that they deserve. Well, what if you are not unsure? What happens if you are not sure what we need to do? Well, it can work for another way too, is we can use maybe support community participation services or just need more. I'm not sure what is, it depends on necessities that you love one. If you have any questions and you have any doubts or you want to have more information, please reach out to Family Network and we'll be able to helping you out. And we need to start talking about this with these different kind of models for self-directing for the different activities and support for your loved one. If you have self-direct services, but they are not things you like to, they are covering by self-directing, please try to do both models, you know, trying to blend them, trying to get what is the best for your loved one. Talk to your support coordinator or maybe consider, again, the life course tool frame to work with you and trying to get the best thing for your loved one. Okay, we have, as mentioned before, we have family and individual mentoring. And this is important because we need to work together as an individual with disabilities and their families they choose to. And we need to know exactly what is the necessity that the loved one has first. We can share different I'm not sure you are able to see this page. We have different forms. This one is the when we have what is the best, what is the skills that your loved one has, how is better work with him, what is important for him. And the last one is how we as individuals, we can work with him to understand better what we need to do or what activities we can work with your loved one to try to understand him and make him better. We have, what is another one? Why is not coming? Okay, it's not coming. What's going on? Okay, here. Again, this is the trajectory that we mentioned before. What is the experiences that you have in your life? What is all the activities that you can do to try to get a good life? And what activities you need to avoid that you don't want for your life in the future to be bad. All these activities, they can be there. They are experiences. They are something that they will be happening to you when you are probably in the school, when you are in high school, when you are out of the school. All these different activities that they helping us to identify what is exactly what you need, what interests you have, what is your experiences that you have to trying to get the good life for your loved one. And of course, we have the support star, who is the one when we can have all the skills the individual has, what he can offer to us to help him to identify different activities for him, what relationships they are important for him, what the technology is part of. If your son is no verbal, maybe we can use iPad, Dynamox, maybe alarm, Alexa. We don't know what technology will be able to use or is in place to help your loved one. What in the community we can find to helping us. Maybe a senior center, maybe the pharmacy at the corner, maybe the firehouse. We don't know. We need to look all around the different communities to try to find different support and services who are helping your loved one in everyday activities. And of course, the last one, we have eligibility. Remember, our kids, they are an adults, and eligibility is part of the program. You need to qualify to get all the different support and services that you need. Your kid has waiver, your kid has Social Security, probably he will be able to have a driver license. What is eligibility. Social Security, maybe he wants to belong to a certain kind of club. In fin, it's different activities and eligibility that we need to go in place for trying to find all that. And all that, we are able to do that by mentoring. And like I say, individuals one-on-one, or you can have a family members to be part of the mentoring system. We can work with everyone. Or like I mentioned before, if you have a financial, or maybe you have, because your kid has some kind of medical diagnostic, we need to be part of the medical fields. We can work with the medical fields, nurses, trying to get the brainstorm to be helping your loved one to get all the services and have all the needs for him. Okay, well, here is part of the mentoring. What is part of the team mentoring? Well, we have the participant, the individual, what he needs, what he wants, what he enjoys. We have family or surrogate. Family has the choice if they want to have self-direct services. What the family want, what the surrogate want, who's part of that. We are one of the members. We have a family member who will be maybe for our different expertise or different experiences, we are able to reach out and we can able to helping you with our experiences that we have in the system about what activities or what support and services will be able to help to try to find for your loved one. And of course, we can have the advisor with intellectual disability in place. That could be your support coordinator. That could be another person that you think is necessary to be part of the team. We are open to integrate everyone who wants to help the loved one in the needs to create a good vision for him. Well, In the mentoring team, we want to have new ideas, and of course, we create different activities. We need to be creativity. We need to get out of the box and start to think big. Of course, in the mentoring, in the center, there must be the family individual, because the family, we notice, is important for each of the planning. We have support coordination. We had the support coordination. We mentioned before the medical team. We had the transition facilitators. Remember, we are living in the light that everything is a transition. We had the direct staff who's working directly to you. And we have another people who want to be part of the life of your loved one and who love him, and he will helping us. They are welcome to be part of this mentoring teams. Well, I know this is different. We family they have different approach. We have different support with all these different tools that we have with the life course. We can find all these different support. We can find different services. We are able to listen what individual and what the family want to say, or what he don't want for your loved one. We are creating solutions. We are creating in base of building another ideas. We need to, like I mentioned, we need to get out of the box and create and start thinking big for our loved ones.
Okay, I see in the Q&A, ask the question, are there blank pages available to print to use as tools to help your individual express their wants and needs?
Okay, this is another workshops that we are having. We have another one who's really interesting, and of course, everybody wants to have back plan. What happens if something is not going according to what we need, what we want to do? This presentation will be in Wednesday, August the 23rd, and we want to have two presentations. One that will be in the morning, in the afternoon, the 12 to 1, and another one in the evening, the 7 to 8. We also have connecting the dots from person-centered planning to participate direction. That will be on September the 6th between 12 and 2 and the 6:30 to 8:30. And the last workshop that we want to have, in base of these topics, that will be participant direction, finding answers and supports. That will be on September the 20th, 12:30 to 2:30, and the 6:30 to 8:30. You are really interested to listen more about this presentation, please, you can register in www.visionforequality.org/events. And please, you can phone, you can scanner. We have a CQ scanner there that you can log directly to the events. Well, apparently this is all the information that we have for you at this moment. We are really happy. And we are wondering if you can answer again the poll. That's to see if, okay, apparently they agree for the beginning. But let me, back again. No,
Yeah, I think the poll is still on there.
No.
I didn't share the results.
That's okay. Please, you, as mentioned before, if you have any questions, if you have any doubts, please reach out to us, and we are able to get all the information for you. I saw there was some in the chat. We have some questions. We want to be sure somebody will be answer the question for you, and we want to send information via email. I only ask for give us a couple, 2 or 3 days to give all this information to our management, and they will be in charge to answer all the questions for you. And again, if you have any need or any mentoring, please reach out to us. Like I already said at the beginning, we are almost 28 advisors that we are all around the Commonwealth of Pennsylvania, and we have with different expertise and for our children. That means we are able to helping you out in any needs. Probably will be no close to you, but maybe will be in the another side of the state. But we are able to reach out to you to give the best. Okay, here is the tool. You can please take a minute and log in. We really appreciate that. This is only for logistic to see if our presentations are getting to you and if they give us a little feedback to trying to work for you and trying to do the best that we can do.